Méthode de acupuncture et d'autres méthodes de la médecine plutôt chinoise. Merci Madame Lynn Wei.
Merci. Bonsoir, bonjour à tous. Je suis Lynn Wei. Malheureusement, pour l'instant, j'ai un petit peu de burn-out, du coup, je ne peux pas parler beaucoup de français. I will speak English if you allow me. Thank you for coming for me and thank you for your time. Today, I will make this conference on the subject of Prendre Soin Du Périnée from the perspective of Chinese medicine. So I do this PPT. I'm happy to make this presentation mainly for, first is to serve our hospital. Second is, thanks to the experience working in this hospital, I try to explain and convince the patients in Belgium to explain what is the real Chinese medicine. Unfortunately, in Belgium, until now, there are still some misunderstanding. People don't know what is the real Chinese medicine. So my work is try to make evolution of it, and also is to make evolution of myself, to work with our doctors together, to learn from our doctors. And personally, I think during the treatment of perineum disorders, my outcome were not super good. But I keep hope to look for other solutions and keep on learning, especially work and learn with our doctors together.
C'est bloqué.
So this is just disclosure. I don't have any conflict of interest with anyone or any pharmacy or anything. Félicitations, congratulations to our Clinique du Périnée is established in our hospital. So, as we all know, to both men and women, the perineum is made up of a group of muscles, tendons, and tissues. And these support ensure the function of the pelvic organs. And this group play an important role of the perineum to support the bladder, rectum, vaginal, ensure the urinary and fecal continence. When there is a disorder, we often see the symptoms like elongation of the pelvic openings, descent of the perineum, urinary incontinence due to the overactive bladder, difficulty to control the gas or the stool, a descent of the pelvic organ, which is called prolapse, difficult during the sexual intercourse, and difficult to pass the stool. I notice among my patients, the most common complaint is pain. The pain in the chronic pelvic pain and vulvodynia pain. And all these symptoms, of course, have negative impact of the quality of life of the patient and emotional well-being. So, is there something, first of all, we can do by ourselves to improve the symptoms? For example, exercises, to maintain a good diet, drink enough water, lose weight, don't push too hard during the bowel movement to prevent the constipation, and quit smoking. Normally this should be here. Sorry. Myself, I don't have experience of any of those treatments, especially the above one. But I read a lot of literature reviews, and when I heard about how the other doctor work, and I think if the self-regulation doesn't work much, then we need a doctor or therapist to help the patient. For example, there's a medical treatment. I think all the doctors here know better than me. And then there are physiotherapists to make rehabilitation, to address rehabilitation of pelvic floor for the patient. For example, muscular training, relaxation, biofeedback, and PFMT, the rééducation de muscle de plancher pelvien, amputation and interventional technique, and the last step probably is surgical treatment. This image is from one of the literature review I read. It seems we can see from here there are many different treatments. There's cortisone, there are creams, various of creams based on different molecules. There is a lidocaine cream, hormonal therapy cream, ketamine cream. There's oral taken molecular injection, manual physical therapy, intravaginal TENS machine treatment, cognitive behavior therapy. I think that's mainly with psychologists, biofeedback, laser therapy. And also I read many other literature reviews which reveal that probiotics, certain solutions, and acupuncture, which is my work, might have some positive impact to assist the treatment. This is another literature review, which, for example, using acupuncture with lidocaine together to help people reduce pain. I make two blue lines here. Here is my work, acupuncture. There is an advantage and limit. The advantage is some research find that it can regulate pelvic floor muscle and nerve function to reduce pain, enhance the control of ability of urinary sphincter. But the limitation is a lack of large-scale clinical trials, and the effectiveness of the treatment is strongly affected by the practitioner's personal insights and skills, which means as a young therapist like me, every year I go back to China to learn from senior doctors to try to catch up to learn more how can we help patient better. And then what interests me is the above, another treatment is pelvic magnetic stimulation. Myself don't have experience on that. It seems the other doctor used the magnetic stimulation. This we will see a few slides later. In the discussion slide, I will mention it again. And then the other treatment, pelvic muscle training, electronic stimulation, Pilates exercises, research, breathing exercises. According to some literature review and some doctor and researchers' experience, it seems those can be helpful. Okay, when we give treatment, we need to assess afterwards. For example, measure of vulvar pain intensity, FSFI, this perineal subscale score, FSFI total score, pain report. So all those questionnaire or assessment to measure if the patient feel better or not. A few years ago, I went to a Royal Belgian Society of Laboratory Medicine annual meeting. There was a doctor, I don't know him personally, Dr. Demusset. He made research about the female urogenital and the gut microbiome. What's that impact to females' urogenital health, the microbiome. According to him, his research mainly focused on post-menopause women. He discovered with the post-menopause women there is a physiological disputes. Namely, there is a decrease in lactobacilli, which is gem. There are some doctors, they had experimental use the tibolone. Myself, I don't know what's that. I check up. It's a hormonal substitution with lactobacillus with lactoferrin together to treat the woman post-menopausal women with vulvar vestibular pain. since 90, but use the probiotics to support urogenital health. It's not something new. Dated back to 1980s, there are already a lot of research found out the probiotics like the Lactobacillus rhamnosus GR1, Lactobacillus rhamnosus 14, and the others. They are all in the family of Lactobacillus. Can be positively impact the urogenital health. There are two ways to generate it, either by orally taking or intravaginal usage. This I learned from Dr. Damien Bourgojon from one of his conferences. I don't know this is real or not. According to him, it seems these probiotics ont été par DM depuis 2021. I don't know if it's true or not, but it's just a sort of information. Voilà, so this is, and I noticed recent year on the market, there are a lot of recommendation of Lactobacillus kispatus. It's one of the gem. And this Histopathus can balance the vaginal microbiota, inhibit the pathogenic germs, maintain the good pH value, prevent the unnecessary bacteria, and in order to maintain the urogenital health and reduce pain. On the market, I just have a checkup on the internet. There are also solutions. For example, chamomile-based, so it's a plant, chamomile-based solution. There are some recommendations to use this chamomile-based solution to let it flow over the perineum from the lower abdomen to the tailbone. It might soothe the pain, disinfect and promote health. Voila. Now come to my specialty, Chinese medicine. So Chinese, first I will generally introduce how Chinese medicine works in general. So we need to make a diagnosis through 4 steps. The first step is 1, observation. So in Chinese medicine, we mainly observe what is most important is to observe the tongue. Well, we need to check up every time, especially at the first time, the size each patient, the size of the tongue, the basic color of the tongue, the surface of the tongue, the basic color of the patient, the gait of the patient. The second step is 1, listen the complaint, patient's complaints, medical history, listen to how the patient breathes, rhythm, listen if the patient cough, listen the cough sound. The third step is 1, ask anonymous to ask questionnaire, ask a question. The last step is cheer to feel the pulse. And in Chinese medicine, we feel the pulse of both 2 hands. That has significant meaning under each finger, 3 finger of both 2 hands, and that enlarge extension to 28 different pulse in Chinese medicine. Well, after these 4 steps, we pose question, Chinese medicine doctor, we pose question to ourselves about what's the status of these patients. First is yin-yang energy status. The patient is of excess of yin or deficiency of yin. Yin means feminine energy, cold, sombre, weakness. Yang on the opposite is force, male, masculine energy, so it's 2 different elements. Or also need yang energy if there too much yang energy or lack of yang energy. The second one is the qi. If there is a lack of qi or not, the fluidity of the qi is flow well, or there is a blockage. The third element is the blood. Again, is the fluidity of the blood is good or not, or there is a stagnation. After all this, we try to understand the pathology of the patient. But be careful, the pathology of Chinese medicine is not the same as Western pathology. The Chinese pathology, we have specific name, which is the Zheng differentiation syndrome. I will speak later. So after this, we reach a treatment plan. There are different tools in Chinese medicine to help patient. We may use one or multiple approach together. So this is moxibustion. Inside it is a plant which names Artemisia arnoise. This is ventouse cupping. That's me, meditation. Qigong Tai Chi exercises. Herbal recommendation, herbal formula. Auricular therapy, acupuncture in the ear. That's my finger, here hand, acupuncture on the body through meridians. Gua sha therapy, gua sha therapy, and the Chinese massage, which names Tuina. Again, according to many research, the physiological explanation of how acupuncture may work. The physiological mechanisms of acupuncture include an increase of mu opioid, MOS, and the beta endorphin. Both that two reduce the perception of pain, reduce the pain. As we probably our doctor all know, they are protein and they are happy hormone. The three process of acupuncture treatment. Yeah, there are some we cannot see here, but doesn't matter. So this is from one of my previous professor, Dr. Nadia Wolf. The three process of acupuncture respectively is sensation, transmission, and effect. Sensation, simple. When the acupuncture needle insert into the skin, that's stimulation at certain acupoints, people feel it, so it's the sensation. Transmission, which is the transfer of acupuncture signals from certain acupuncture points to the brain. For example, the photo here, we touch the needle. When the needle touches the patient, it gives a signal to the central nerve system, and this central nerve system, this is through peripheral afferent nerve and transmission sensory information from the spinal cord to the brain. And then the brain again activates the efferent nerve or neuroendocrine pathway to certain target organs. Effects we cannot see here, the total text, but fortunately you can see the first sentence. The effect represents a response in the target organ. So this purpose of the treatment is work on which specific organ or cells. The basic meridians, there are a few meridians we tend to choose during the treatment of VOD. The basic meridians are LynnWEI, which is in the middle. Kidney meridian, both two sides are the same. From the middle of the feet, both two sides the same, going up until here, both two sides the same. Meridian system is a functional network of the body. I know for Western doctors are difficult, not easy to understand. It's a network all of our body, and the energy qi flow through all the meridians. But in vivodynia treatment, the most important two meridians are this one and this one. Zheng differentiation, it means the subtype of the pathology. In vivodynia treatment, there are two subtypes, which is the first one, liver qi stasis, starts the qi de foie. The second subtype is spleen qi deficiency, vide the qi de la heart. Liver meridian starts from the first toe, both two legs going up until the face. Both two sides are the same. Spleen meridian starts by side of the first toe, also going up in the inner side, going like this. I invented two different suppositoire. Suppositoire 1 is for that's the qi de voix subtype. Suppositoire 2 is for vie de qi de la heart subtype. Both the two are based on many different herbal molecules. But the most important and the basic herbal molecule are Pinus pinaster, ortie, curcuma. Method C, so method A is acupuncture, method B, the previous slide we see is suppositoire. Method C is cream, again based on plants, but we use this cream during giving massage treatment, which is method D. And this massage is from Ste-Anne St-Rémi, and is a doctor who's a specialist of Chinese medicine. He gives a lot of lectures. He published a lot of books about the genital therapeutic massage with plants. There's a YouTube linear, and there are books. So his research reveals our sexual organ play a major role in our physical emotional health. When there's especially emotional trauma and stress are blocked in the pelvic region, that cause tension in the muscle, ligament, and tendons, that result in accumulation of toxin, energetic knots, and tangles. In French, we say les nœuds. So this massage is supposed to help people resolve physical and emotional blockage through the pelvic area massage. Well, that's from this book. I retrieved from this book. For example, there's a note here. It causes pain because the radiation pain could be enlarged to extension to the other area, including lower back pain. So again, this is retrieved from this book. This is a cream also invented by me with some herbal formula, based on some herbal formula. I am training a physiotherapist colleague to help me to make this massage for patients together. Method E, Qigong exercises. It's a Chinese sports, kind of physical activity. May reduce the stress, reduce the pain. Discussion. From the very beginning, there is a slide which shows in some literature review, some doctors use magnetic stimulation to reduce pain. I myself, I don't have experience. It seems the magnetic they use is eddy current, but I have a question if the TMS machine can be useful or not. For example, from our Shihak Hospital, long time ago, there's a Dr. Kemes, who's probably the first one in Shihak who applied TMS technique. That's one type of TMS technique with the bobbin. There are two ways to use. Either we choose certain lobe, touch on certain lobe on the cranium, or we can use it peripherally for muscular or the other pain. But this is another magnetic mechanism. Basically, it's a data boost stimulation. So this is my question mark. From some literature review, there are many conditions can be helped by TMS, not only for neurological issues, also for douleur neuropathy, for fibromyalgia, visceral chronic pain. I wish start from this year, I have a TMS machine. I wish start from this year I can help patient by TMS machine. But I don't know if it will work until what level, or it doesn't work. This I need to try. Cannabis. There are different sources of cannabis. On the market, it seems recent year there are some doctors use the PEA, which is from endocannabinoid, that suppose also can reduce some pain. There are also many doctors already discovered when CBD is applied that can inhibit nerve activity in order to reduce the pain. There are also the other research used, for example, for experiment on rats, endomyosis pain rats, use oral CBD at that dosage. They are also for the painful pain, use the tampon coated with CBD oil. That's it. But I myself, I didn't meet a patient with allergy of cannabis yet, but according to another doctor from Shihak, Dr. Michel, it seems he noticed among his patients there are also some patients have allergy to cannabis, so have to be also careful of this usage. But that's the reference. So that's the end. Thank you very much. Merci beaucoup.
Vous avez dit que vous avez, avec la médecine traditionnelle chinoise, vous faites l'interrogation, et puis vous examinez, et sur base de ça, vous décidez le choix de si c'est donc vous avez des critères, est-ce qu'il y a des scores, ou est-ce que c'est vraiment avec le feeling que vous allez...
There's a feeling, but it's based on experience.
Okay.
There are also scores, but it's a Chinese version of assessment, questionnaire, which are based on differentiated, which are different than our classic assessment. And the patients, after the treatment, if they feel less pain or not, that's the direct checkup.
Et vous donnez combien d'essais avant de juger si c'est efficace ou pas efficace? Vous faites avant de changer de stratégie.
I will suggest patients to take 1 session per week during 4 sessions, and then we have the first checkup if there's improvement or not. And then maybe we need to change the treatment plan, or we continue the protocol, but less frequent. In the following is just 1 session for the maintenance.
Et en gynécologie, do you have experience about the version of the baby? Which position to head position? Yeah, having the baby.
On theory, yes. I didn't succeed in it.
Okay.
On theory, yes. They say use the moxa to show a certain point can be helpful.
But you know the point?
Yes, it's on the feet.
And about helping the woman to get in labor, because we can also use acupuncture for that.
Yes, a lot of patients.
And fertility also.
Yes, for fertility. Also, I use acupuncture and herbs. Yeah, of course, the herbs are different than these molecules. And then long time ago, there was a doctor in Germany. I think his name is Pulus. He made hundreds, thousands of research on women, and he made his protocol about how frequent, started how many months before for the women who have require of fertility, and how much frequent. The day function, so the woman to go IVF, the day before and the day after, one more extra treatment, acupuncture treatment, before the punction and after the punction, and the day before and the day after. The doctor, I think it was German doctor, Pulus.
What other pathology we can send the patient to gynecology?
So yes, so if we have un pass avec vulvodynie,
chronic vulvar pain, we can send it to you to try.
Yes.
okay.
I cannot say it's specialized on women, but I also accepted many teenagers women, girls, who have anorexia. Anorexia, you don't want to eat. Also, there are many women have lipedema, lymphedema, swollen legs. That is acupuncture and the cranial massage with another sort of herbal cream. So I invented more than 10 different herbal cream for different pathology.
And if we have a patient in hospitalization for vomiting,
Yes.
we
Like
throwing
in
away,
the beginning of pregnancy,
vomiting of
some women
pregnancy.
have a lot of vomiting.
Can we call you so you can go to our home to help her with that? Yes, because someone did acupuncture on a patient from the family and it worked really well. So we might call you and you can come to maternity directly.
I will be happy to help.
And maybe last question, in menopause women, for instance, hot flashes, do you think there is something you can also suggest?
This juice that can be helped by acupuncture and herbal cream.
Okay.
So I have 10 different cream. Cream number 1 is for cicatrices. Cream number 2 is for sebum, BCBOs. Cream number 3 is for acne. Cream number 4 is for anxiety. Suppositoire. Cream number 7 is for constipation. Cream number 8 is for arthrose. Cream number 10 is for lipedema, lymphedema. And cream number 9 is for the women of menopause hot flash. So when I introduce the cream, of course I will explain the different molecules of herbs in each cream. And I will teach patients to do auto massage. How they do massage, but they don't need me. The first time I show them, and it's not too difficult. They learn and they do massage by themselves with the cream through different meridians of our body. Question? No more?
Thank you.
Merci beaucoup.
Yes.